Have you ever practiced a speech over and over and over and over again because you were afraid that you would look silly while you were giving it? What about brought a friend to a party because you were afraid people would think you had no friends? How about texting or emailing to book an appointment instead of making a phone call because phone calls and talking on the phone feels uncomfortable and awkward? These are all examples of safety behaviors in the context of social anxiety.
Or strategies that people use to deal with or avoid the outcomes they think will happen when they feel anxious. The thing is that when we use these kinds of strategies, our anxiety about the possible thing that we think will happen, well, that anxiety, it tends to stick around. Although safety behaviors can help relieve anxiety in the moment, relying on safety behaviors in the long term can prevent you from learning that the thing you're scared of isn't actually so scary after all.
The Sex and Anxiety Research Group at U Ottawa studies what's happening when people use safety behaviors. The cognitive behavioral framework is a way to understand how people's thoughts, feelings and emotions, physical symptoms, behaviors, and things that happen in the environment all go together.
In the INSITE lab, we study topics like sex, tech, and social anxiety. With the Sex and Anxiety Research Group, we study how social anxiety, anxiety related to being judged negatively by others in social situations, and technology-mediated sexual interactions go together or not. Technology-mediated sexual interactions, or TMSI for short, occurs when people exchange sexual content that they made themselves about themselves using some kind of communication technology like a smartphone, a computer, or anything connected to the internet or Wi-Fi. TMSIs include sexting, cybersex, phone sex, or photo exchanges. To find out more about TMSIs, check out our video linked below.
So, thinking about safety behaviors, cognitive behavioral framework, and what we study in the lab, we think that 1, people who are often socially anxious might avoid TMSI, or 2, might use TMSI as a safety behavior to help relieve anxiety associated with engaging in sexual activity. Or 3, maybe it's a combination of the two. They might avoid some TMSI and use others as a safety behavior.
Let's explore the first idea that people with high levels of social anxiety won't do TMSI. When we look at the research, we see that a lot of people with and without social anxiety are afraid of talking about sex, especially with their sexual partners and when it comes to their likes and their dislikes, because they're afraid. They're scared of being seen as inadequate, as not competent, and as lacking the necessary skills. This might be even more present for people who experience high levels of social anxiety. If these levels are high, we expect TMSI to go down as levels of social anxiety go up.
Now, recall the second idea we proposed. People who are very socially anxious might use TMSI as a safety behavior. And guess what? Some research supports this idea. The benefit of talking through technology is that people can hide visual or auditory aspects of themselves and can take however much time they want or need to respond. And these benefits bring that sense of safety in what is perceived to be an anxiety-provoking situation. So, highly socially anxious people might use TMSIs more often compared to people who are not socially anxious, because TMSIs feel less scary than interacting and communicating sexually in person. But some TMSIs are more safe than others. Like text let us hide more parts of ourselves than the video does. That's what idea 3 is about, that there are some TMSI that people may do more of, and some they may do less when they feel high social anxiety.
This is what we think. Now what? Well, we're actually in the process of testing these ideas out in research funded by the Social Sciences and Humanities Research Council of Canada. Stay tuned for our results.